Hi, my name is Constance Nelson. I am the lead therapist and owner of Constantly Healthy Counseling Coaching. And today we have Dr. Franz here. I have known Dr. Franz for 28 years.
Yeah.
28 years.
That makes you old.
It does make me old. It makes my son very old, right? She saw my son at the age of 2.5 at a time where we didn't quite know what was going on with him. He was very, very ill. And she was one of the last doctors that I saw. I went through a lot of different doctors. And Dr. Franz really provided a safe place for us to figure out what was going on with Parker's illness. And this is what I really love about her and continue to love about Dr. Franz, is that she doesn't give up and she figures things out. And if she can't figure it out, then we go figure it out. And I can remember she told me, look, I have a practice and I'm doing the best I can here. I have all these great ideas. And I was like, I will run these ideas. So I really like the collaborative piece. I feel like she really empowers her clients to take a lead in their own healthcare and their children's healthcare, rather than being a dictator, like this is what needs to happen. It's a very collaborative kind of dance, I think. What do you think? Yeah?
Yeah.
Mm-hmm.
I love that. I love hearing what I do from someone else.
Yes.
Because that is it. And so the Western medicine model has been very dictatorial for decades. Okay, because knowledge, then we give you knowledge. And when I started practice, I was like, no, I want to be the parent's guide. I don't live with them. And I don't know their kids 24/7. That's the parent's job. So in a collaborative relationship, we work together. Mm-hmm. And it started simply by listening, by just listening to what they say. Mm-hmm. There are lots of studies done that in the average medical interview, the patient gets to talk for, I think, 3 seconds before they're interrupted. Wow. And I thought, well, that is really interesting. So I think mine's 11. Okay. But anyway, but learning to listen, and other little things along the way, like wives' tales. People go, that's an old wives' tale, and I go, yeah, but that doesn't make it mythological. Wives' tales have a fact-based reason for them. Like one of my favorites was just that in the South, when young girls get married, everybody had to have silver, and I was always like, why? Okay, why do you have to have silver? Well, the reason is really quite simple. That sterling silver, say pitchers, they used to put milk in it. And the sterling silver leaches colloidal particles into it and kept the milk from becoming bad. So it had antibacterial properties. And I went, well, that just makes sense. So when you investigate all these wives' tales as one aspect and listen to parents, I got so much more out of it, and it was such a better relationship, because that's really what it is. That
out of the box,
right.
That's an out of the box thinking, because I went to many doctors before I found you, and that out of the box thinking was the first time I had ever seen that. And when we had Parker in the beginning, we didn't know what was wrong with him, so both of us, and you were not afraid to go, I have no idea. Which I had never had a doctor be that honest with me, that we don't really know what's wrong with him, because this is before autism was even on the map, and we didn't understand him. So I love the fact that you look outside the box of what's happening, and I don't think many practice, and that's why you're so different and special. That's kind of what
But yeah, definitely outside the box. And our mission statement is to empower the lives of those we touch through education of mind, body, and spirit, because it's way more than just what you see in front of you. Like with Parker, it turns out that he had an injury from a medical treatment, and it affected his nervous system and everything. And the most powerful moment I remember, I had just started learning homeopathy, and so I said, oh, let's just try this remedy. And I'm sitting there going, okay, I have no idea.
And I was so desperate. I'm like, I'll try anything. Let's just do it.
And it worked.
Like magic.
Yeah, it really did. And it's like, okay, so there are other options. There are other therapeutic options to treat a lot of these deeper concerns. And it takes time and it takes work.
Mm-hmm.
I mean, that's just a given.
And don't you give, and I do this too with my clients, and again, Dr. Franz, she owns the Franz Center. My clients too, when my clients are more willing, when they're really stepping in and they're really trying, I give so much. And I give anyway, we both do, I know you do too. But those parents or those clients that are just like, they're here and they're here a couple of times a week and they just really want to get this work done, I really make sure that I give them everything I possibly can, because they're going to carry this load. They want to be, right? That's a collaborative piece, I think, right?
Yeah.
We need them to be empowered so they're in charge of their own healing. And I never tell a client what to do. Like, client goes, what do I do? And I'm like, I have no idea, because I don't feel like I have that kind of power. But I can, help them come to their own center. Right? Feel into their own goodness and be, okay, this is what I need to do. I'm like, absolutely. And isn't that better than being told what they need to do? And that's kind of what I feel with you. You're very empowering that way.
Well, sometimes I do tell people what to do. You're going to do my way right now because it's just that important at this moment.
Right. You have to step in with your medical-ish, your medicalness, and go, okay, this is the way it needs to be. This is my medical opinion. This is what's happening. Agree. And me too. If there's things in the background that they're not taking care of, abuse and things like that, that is something we have to address for sure.
But I will ask them, because there's no point in my telling anybody what to do if they're not going to do it. And I've actually had that. I've had recommendations and they go, we're not going to do that. And I go, okay, thanks. I appreciate the honesty, rather than leaving, not doing it, coming back, they're not better. So I go, all right, let me think of what else we can do. And I just, I love the education piece. The other thing I do is many times in children who are verbal, I will ask them, what do you think I should do today? I will ask them. People go, why are you asking the child? I go, just because the children often know. And they'll say, well, I don't know. And I go, well, do you need a medicine today? And I've had many kids say, no. And I go, okay, then I'm going to try something out of the box.
So,
because you don't need to go to the hospital. You're not dying. I don't allow anybody to be endangered.
You're like the child whisperer.
Someday.